from Virginia. Lived here all my life, except for when I went to college at Syracuse University. Though nobody told me about lake effect snow, though. I quickly came back to Virginia as quickly as
Yeah.
possible.
That's
Love
funny.
those 4 seasons, you
Yeah.
know.
Yeah. So you grew up in Chesterfield, Virginia?
No, actually, and Chesterfield is a suburb of Richmond, but yeah. So yeah, Richmond City, the west
Very
end of it.
cool. And we
Mhm.
have Byron from Chesterfield, Virginia. We have Lori Fredericksburg, Virginia. This is the Virginia Zoom. I just got chills, you guys. So excited.
Come on, it's so good. I love it. Oh, I see my friends Byron and Diana are on. I had invited them on. That's awesome.
Yeah. Very cool. We're going to start in just a minute and we will record. Doug, does it take you a couple of minutes to start the whole streaming thing or no?
I'm already ready. I just have to
Okay.
push one little button.
Okay. Perfect. Welcome, everybody. If you have a chance, go ahead and type in the chat where you are Zooming from, where you are joining us from. We're super excited that you guys are taking time out of your night to join us tonight. I am really excited. I have never hosted a men's event. We usually kind of talk about specific topics, but I thought this was great since it's Men's Health Month. Bethlehem, Pennsylvania, Jacksonville, Florida. Yep. San Diego. Oh, beautiful out there. Pennsylvania. Did everybody know that June is Men's Health Month?
Yes.
Did they know?
To the men, a holler and a swaller. We are going to drop some knowledge tonight and help us men live longer. It's going to be wonderful.
I was joking around with the women. I was like, the women need to get on the Zoom to watch because, you know, quite often it's us taking care of you guys with the getting you to the doctor's appointment and making the doctor's appointment and, you know.
That is true.
All right,
sometimes.
8:01. I want to respect everybody's time. So if everybody can mute themselves, if you're not muted, if you guys can mute yourselves, perfect. And then I am, Doug, if you want to start streaming, I'm going to go ahead and let's see. I'm also, Doug, going to make you co-host. Just in case something happens on my end, but.
All right. Hello, Facebook. We are live. Ready to roll.
Awesome. All right. Can everybody see my screen? Perfect. Okay. I am going to start recording.
Recording in progress.
All right. Hello, everybody. I am so excited to bring you the Men's Health event. June is Men's Health Month. Let me actually get to that. Let me actually get to that slide to promote this. So I hope everybody knew that June is Men's Health Month. May is Women's Health Month, right? It kind of coordinates with Mother's Day and Father's Day. But there's a lot we don't know, and I am super excited to have some of the men on here to share their stories and share their education and hopefully help us all get a little bit healthier and not, you know, not just prevent disease, but also maybe try and reverse and get a little bit healthier. So I am going to go through these slides, go through part of the slides, and then I have several speakers that I am really excited for you guys. My name is Karen Orlowski. I live in Cumming, Georgia, and I have been with the Juice Plus community for, taking Juice Plus for 20 years and with the community for 18 years. So it is what has helped me keep my family healthy, and I love to kind of pass that along and help others get healthy too. So all right. So let's do some statistics. Let me move this out of the way. So men are 17% more likely than women to have cancer. This second one, I was kind of laughing with a friend because I said 50% more likely than women to have hearing loss. I don't know. I'm going to say it's selective hearing. Do they really have more hearing loss? I don't know. 50% more likely than women to die of heart disease. And yet men are 50% less likely than women to seek preventative care. And then by the age of 100, if we're lucky enough to live to 100, men are outnumbered by women 1 to 8. You know, I just put this slide in here because, you know, I joke around that my husband eats like Fred Flintstone. It's a lot of meat, potatoes, some vegetables, but, you know, it's mostly meat. And so, you know, we have to be careful. I'm going to talk a little bit about animal protein. You know, I'm not trying to get anybody to be vegan tonight, but the more we can be careful with the choices that we are making, we're looking at, you know, all of the processed meats, the salami, the hot dogs, the bacon, the the deli meats. All of those are known causes of cancer, colon cancer, different things like that. You know, but we also want to be selective and try and limit the amount of meat we eat, and put on our plate just a handful of meat, right? Just a little bit of meat and mostly vegetables and some healthy grains. If somebody can mute themselves. Why are we so unhealthy? So lifestyle habits, food quality is decreasing. 70%, 60, let me mute somebody. Okay, thank you. So it's actually 60 to 70% of what we eat is processed. Dr. William Boltzowitz, who is a GI doctor, he's got some great podcasts if you guys can look him up on YouTube. He says that 60 to 70% of what we eat is processed foods, 30% is animal protein, and then 10% is the food that we're supposed to be eating every single day, the fruits, the vegetables, the whole grains, the beans, the legumes, the nuts, the seeds. We need to flop that. It needs to be 70% fruits, veggies, whole grains, nuts, seeds, you know, beans, legumes, maybe 20% animal protein. If you can get it down to 10%, that's even better. And then you can have some processed foods, but it shouldn't be the main portion of our diet. And our produce right now has a lot less nutrition, and we're going to talk about that. So what can we do to be healthier? We don't have time to go over all of these. We'd be here for a couple of hours. Exercise, sleeping 7 to 8 hours, managing stress, drinking water, and eating real food. We're going to focus on eating real food. So we kind of have a choice, you know, on what our health is going to look like when we get a little bit older. So which one would you choose? You know, we've all seen the people. I met a woman one time at a health event that she said, you know, what time does this end? I've got to go running in the morning. And she was in her 70s and she was going to go run 18 miles the next morning. I can tell you that in my best shape, I never ran 18 miles. Why eat real food? 75% of chronic disease is preventable with good nutrition. That is amazing. A lot of us are told it's genetic. I was told with a lot of the things that, you know, I have health issues, that I don't experience the symptoms anymore, that it was genetic. There was nothing I can do. And guess what? I reversed that with good nutrition. And I think so many of you guys can as well. So let's talk about fruits and vegetables, because I know when I was a kid, my mom always said, eat your fruits and vegetables, but never really explained why. So the bad news is oxidative stress. Even just sitting here right now, our body is creating oxidative stress. Oxidative stress creates free radicals, and free radicals are the bad guys, and they actually damage our cells. And so they cause aging and disease. The good news is that we can slow that process down and protect our cells with antioxidants. And antioxidants are found in fruits and vegetables. They protect our cells from the oxidative stress. So this is a little funny. A lot of times people go, what happened to 5 to 9? We really need 7 to 13 servings of fruits and vegetables every single day. The produce that we pick is, you know, it's picked way before it's vine ripened, so it's not, doesn't have all the nutrition that it should. It's transported thousands of miles. I went to the grocery store today to get blueberries. I know blueberries are huge in Hamilton, New Jersey right now, and they were from Mexico. We don't get get enough variety from the foods that we eat. We need to eat the rainbow every single day. Whatever is in a tomato is different than what's in a blueberry, and it's different than what's in spinach. So when you're eating the same fruits and vegetables every single day, you're failing to meet the nutritional needs. So it's actually 93% of us are not getting enough fruits and vegetables every single day. I wanted to throw in here just a couple of little tips for you guys. So keep fruit easy to reach. You know, when we're hungry, we want a snack. Instead of going for pretzels or instead of going for something, if you have the fruit readily available, you're going to hopefully eat that. You know, taking fruits and vegetables with you to have as snacks. Buy the baby carrots that are already cut up. Make it convenient for you. Take foods like apples, bananas that are easy to just eat. You don't have to do anything with them. You know, rediscovering new or forgotten vegetables. Go to the grocery store and really take a look around instead of just going for the same old thing. Check what's in season and what's local even, because that's going to have more nutrition if it didn't travel as far. And then swap out your old favorites for some, for some new things. Look up some new recipes. So let's talk about fruits and vegetables versus multivitamins. So the first multivitamin was actually sold in 1943. It was created earlier than that, but sold in 1943. And why? Because we had nutritional deficiencies because people weren't eating right. And so that's kind of been the standard for a lot of people. That's what we see on TV, on commercials, and that's what doctors recommend. But our body doesn't work that way. Our body needs the synergy of all of the nutrition that's in the fruits and the vegetables. So an apple has approximately 10,000 phytonutrients. Oh gosh, I've heard that, broccoli has 13,000 phytonutrients. So we just don't know, there's thousands in there. The best multivitamin might have 30 or 40 different ingredients. So it's missing the thousands of phytonutrients that our body needs every day. What's in an orange is different than what's in a multivitamin. 5 milligrams of vitamin C in an apple is way more effective than 1,500 milligrams of vitamin C in a multivitamin. So when you're missing the nutrition from the fruits and the vegetables and trying to replace that with a multivitamin, your body doesn't understand. The manufacturers put 1,000, 1,500 milligrams in something, hoping that your body is going to absorb that. And most multivitamins, the majority of it is not bioavailable, which means your body is not absorbing that nutrition. It's just going right through. So there is a huge difference between multivitamins and fruits and vegetables. We cannot bridge the gap in our diet by not eating, the fruits and the vegetables by just taking a multivitamin. Okay, I am excited to introduce my friend Doug, and he is going to take over from here for right now.
All right. Well, thank you, Karen. And I'll tell you what, those statistics you were sharing. Oh, thank you, Karen, so much. And those statistics you were sharing were completely me. I mean, those statistics about heart disease and sickness and not living as long. Man, it's weird because I've been hanging. Oh,
I lost it. Can you find it?
Karen, maybe you can mute the mouse for me.
Yep.
Okay, so I've been hanging around this Juice Plus community for 20 years, more than 20 years, but I haven't always been completely consistent or very serious about my health, honestly. My wife was really into it early on, and I was just that guy that was like just living life, and you know how it is. You put on a couple pounds a year, and it's not a big deal until it's 10 or 15 years later, and you've put on like 50, 60, 70 pounds, It's a serious problem. Well, there's a lot more that comes along with poor diet and lack of exercise and poor lifestyle than just how you look. There's stuff going on the inside, and that's what this community is really about. And while most men are less likely to seek preventative care, as part of the Juice Plus community, I have learned how important it was, how important it is about prevention. So I did get checkups once in a while. And then at one point I got checked up and I got my heart checked because I have a bad history, a family history, And, I was eating good some of the time because, again, I was hanging around with the Juice Plus community. But I was also overweight in addition to eating some healthy food, but I was also eating lots of unhealthy food. And I have a terrible family history of heart disease. So it caught up with me. You can't always run away from your family history. It turns out like everything in moderation isn't always good, okay. It turns out that you have to address these issues, and that's what we're talking about tonight for you guys. We want you to get preventative in your health. So I was lucky because I went in and I got checked out preemptively, and I took control of my health. I avoided what was probably an imminent heart attack, but I did have to get 2 stents in both my right and lower, one in each one, right and lower descending coronary arteries. That left one is the widowmaker. I mean, I was right there. It was severely blocked. That means 75 to 99% blocked. I was right there. I could have been playing golf one day in 100 degrees like I was doing yesterday and just had a heart attack, especially after a high fat meal, after your veins constrict. So I figured it out. I got those stents put in, but since then I've made changes. I've been 100% consistent nowadays with my Juice Plus, my fruits, veggie, berry blend, and my omegas, which you see on the screen right there. I've also used Complete. We'll talk about that in a second. I'm also following the Ornish Reversal Diet, which is, it turns out you can reverse heart disease. You can reverse diabetes. Like, you have the opportunity to take control of your health. All right, so this community and these products have been a huge part of my health transformation. I don't know if I would have been able to make these changes without this community and with the Juice Plus products and all the things that goes into that. So I urge everybody hearing this presentation to take control now. Take control now. So let's talk about this fruit and vegetable blend and berry blend and omegas. I mean, you think about it. I eat as a vegetarian now, but even as a vegetarian, there's no way. I mean, let's just read this. Acerola cherry, apple, beets, peach, pineapple, lemon peel, cranberry, dates, orange, mangoes, prunes, beets, broccoli, ice bran. I don't even know what that is. Cabbage, lemon peel, parsley, carrot, garlic, kale, spinach, tomatoes, artichokes, bilberries, blackberries, blackcurrant, cranberry, elderberry, blueberries, cocoa, Concord grapes, pomegranate, raspberries. I mean, when's the last time you ate all that stuff? We're getting this every single day when we eat Juice Plus. And then there's the omegas, which are part of a heart healthy plan. Our omegas are vegan, and we get them from plants, ocean plants and seed plants and tomato plants and pomegranates and things like that. And that really allows us to bypass the fish and all the potential harm that can come with that through things like mercury and whatnot. So Juice Plus is a really simple product. I'm on to the next slide. And it's made very simple. Okay. The company partners with family farmers. We've been doing this for over 20 years. My wife and I had an opportunity to visit one of the farms last year, and it truly is a family farm. The produce is picked at the peak of ripeness, quick frozen. It's not shipped on a truck. It's not picked 2 weeks early and then shipped from Guatemala on a container vessel or something like that. It is ripe on the vine, picked, quick frozen, and then it's processed and where it's just pulverized. Okay, the seeds, the skin, everything, because there's great nutrients in there too. And then it's dried at a very, very low temperature. Not a very, very low. It's dried at low temperatures. To remove the water, okay? And then those powders that you end up with just powder, you either put those into our vegan capsules or we put them into a soft, chewable product. So it's a unique product. It's the #1 selling nutritional product in the world. It's a food. That's a really important distinction to understand, that we're not talking about, a supplement. Supplements have supplement labels. Food has a food label. So when you look at our product, it's not a supplement label, it's a food label. It's non-GMO, it's vegan, dairy and gluten-free, and kosher. And I love #2 here. It's NSF certified. That's a third-party agency that comes in, that verifies that what's on the label is in the product, what's in the product is on the label. There's no harmful or artificial ingredients. There's no contaminants, pesticides, or banned substances. We even have NSF Sports certified option in getting Juice Plus. You can purchase the one that the Olympians are using because they have to have a sports certification to guarantee that they're going to pass all of their drug testing and whatnot. And this product is being used at the U.S. Performance Center in Charlotte, where the United States Olympic team is training. It is the most researched nutritional product in the world with over 48 published studies. And Dr. Pohl's going to cover that in just a moment. But something that's really exciting, we have Dr. Pohl on here telling why he recommends Juice Plus to his patients, but he's just one of over 8,000 healthcare professionals that are recommending this to their patients. And we have this health study, okay? We have the family health study that's been going on for 20 years. Over 250,000 recipients have reported this, a lot more. 4 million kids and adults have done this study. And so it turns out if you get Juice Plus, you're going to get it for free for a kid between 4 and your kid up to 25, okay, with your adult sponsorship. Now, what are the results of that? Well, we're pretty clear. We've had 4 million kids do this. They start consuming less fast food and soft drinks. 61% start eating more fruits and vegetables. 71% start drinking more water. 66% more visit the doctor less often. In fact, our child, when he turned 18, he was going for like his last visit at the doctor, and they had to pull his records out of storage. He hadn't been to the doctor in so long. I mean, it definitely improves your immune system. We just don't get sick like we used to. 60% of the kids are missing fewer days in school, and 56% are using fewer over-the-counter or prescription drugs. It's pretty amazing. The next slide covers another critical part of what I've found to be helpful in our family, and that is the Juice Plus shakes. We have our complete shake on the left, which comes in chocolate or vanilla. It is a delicious, delicious shake. We do a chocolate shake every morning with peanut butter powder and frozen cherries. It's just delicious. Now, remember all those fruits and vegetables I read to you earlier? Well, what if we add to that every single day? We're going to add broccoli, radish, alfalfa sprouts, mushrooms, amaranth, quinoa, millet, water washed soy, chickpea powder, pea and rice protein. So we're getting all these superfoods. We're getting all of these great macros in this product. 7 grams in fiber, great protein. Low glycemic index. So when you have this, when I was working a full-time job, like in the office, I would have this for breakfast and it carried me right through to lunch, just a smoothie. And it improves your gut health. Okay, so it's really, really awesome. I recommend it highly. That's one of the quickest ways I think men can improve their eating is by adding the complete shakes for breakfast, because a lot of guys are eating something not so good for breakfast, okay? You think about what you're eating and then compare the broccoli, radish, alfalfa sprouts, mushrooms, and all that good stuff. Put that with a great plant milk and you got a great breakfast. On the right is our Perform shake. It's more of a recovery type of a shake. It is higher in protein. It's 25 grams versus around 14 to 17 in the other. Muscle recovery and repair. It supports bone health. That includes mango, guava, lemon, mushrooms, acerola cherries, beetroot, tart cherry, and water washed soy. So it's both products are awesome, but of course I'm partial to the complete. That's just my favorite. The final thing I want to cover with you is something new from Juice Plus. This is a new, amazing. I don't know if you've been hearing about things like ashwagandha and rhodiola and alpina galanga. I can hardly say these things. I never even heard of these things a few months ago, but all I know is this. A lot of people get sluggish in the afternoon, and a lot of people want to be sharper in their mind, and a lot of people don't want to be hammering coffees and espressos all day. It raises your alkaline and it's just not good for you. So this uses the coffee berry, not just the caffeine, but the entire berry, including the bean, the berry around the bean, everything. Has some sage in it, some mushrooms again, and it sustains your energy with all natural ingredients. You don't get like that jittery feeling. You just get a sustained energy with mental clarity. I like using it before my afternoon or evening golf league that I play in, and it just really gives me a great, just a little push. And it's really, really good. It tastes delicious too, so you might want to check that out. All right, so we are going to transition now over to Dr. Pohl. He is a wonderful, wonderful physician in I believe near Gainesville, Georgia. But Dr. Pohl, I'll let you correct me if I'm wrong. But he is just amazing, and he's going to cover what's going on with some of the clinical research and what Juice Plus actually does in your body. Not just a testimony, like I'm telling you what I think about it. These are the facts. This is the fact, Jack. All right. And Dr. Pohl's going to cover it. So Dr. Pohl, please unmute. Let's hear from you.
Thank you, Doug. And thank you for inviting me, Karen. I'm Dr. Joe Pohl. I'm in a suburb outside of Atlanta, close to Gainesville. I go there often. I'm an OBGYN physician, but tonight we're going to focus on men's health. In the paper, here in the local paper, if you see if you can read that, on June 1st, World War II vet turns 100. His secret, eat good food. In Juice Plus, we like to say, eat real food. My dad passed about 18 months ago at the ripe old age of 99. And if you asked Frank, what's your secret to your longevity and almost making it to becoming a centenarian? He would say, eat lots of fruits and vegetables. He made amazing vegetable soups. Walk everywhere. Sleep. It's not rocket science, is it? In 1998, I left the military. I had my exit physical at Walter Reed Army Medical Center in Washington, D.C., where I was faculty and staff. And my blood pressure was like 140/90. My cholesterol was a little over 200. And they said, Dr. Joe, you're not really healthy. I was about 20 pounds overweight at the time. And I was about a 180. And I topped out at about 200. Moved to Atlanta. Had a private practice, and a patient walked in the room. She was a nurse, and she said, let me talk to you about Juice Plus. Right around that same time, my wife was playing tennis with National Marketing Director Carol Garner, a good friend of mine now. And my wife was introduced to Juice Plus. We compared notes at home. My daughter was 5 at the time. My sons were 7 and 11. We got started on Juice Plus. My oldest son has asthma. And let me blend in right here. There's a study that was done at the University of Maryland, and a lot of people that take Juice Plus that have asthma and have hypertension notice an improvement. It may not be the same experience for you, but I have hypertension, and it normalized my blood pressure, and it helped my son's asthma. There's a study done at the University of Maryland where they randomized 3 groups to placebo, fruits, vegetables, and berries. And they measured their brachial artery, and they also measured their nitric oxide levels. And just to summarize the results, the ones that took the fruits, vegetables, and berries had the highest nitric oxide levels. And why is that important? Nitric oxide, as Dr. Sears likes to say, our endothelial pharmacy makes nitric oxide in every little blood vessel, from big artery, big vein, all the way down to the capillaries. It makes nitric oxide. What does it do? It dilates our blood vessels. It regulates our blood pressure. And in our lungs, it's a bronchodilator. It's an amazing product for people with hypertension and with asthma. Now, men's health. I embraced Shred 10, and all the principles of Shred 10 helped me shed 40 pounds and normalize my blood pressure, normalize my cholesterol, and not have to be labeled as a diabetic. I reversed my metabolic dysfunction, and you may not have the same experience, but I'm sure that you'll have at least an improvement if you take a look at this product. So I'm an OBGYN physician, and I know that this is men's health, but I started sharing this with my patients because there's an OBGYN in Mississippi, Dr. Doug Odom, who's an amazing colleague of mine, who did a study and noticed that pregnant patients on Juice Plus had a much lower rate of getting preeclampsia and preterm labor. I was in on that because 10% of my patients delivered early, 10% of my patients had preeclampsia, and they always went bad 2 o'clock in the morning. So I like to tell my fellow OBGYNs, if you want a product that will help your patients and help you sleep better at night, you need to take a look at Juice Plus. So I already mentioned the study at the University of Maryland that showed that it increases nitric oxide production, which is great for hypertension and asthmatics, and maybe even patients with COPD. I'd like to highlight 2 other studies kind of in general. And before I do that, let me just say 48 studies. You have lots of options when it comes to micronutrients. The CDC says that 90% of us are very deficient in micronutrients, not macronutrients, protein, fats, and carbs, but micronutrients. There's over 100,000 of them and new ones being discovered every day. Now, some people criticize the Juice Plus studies saying, oh, they're small, they're pilot studies, and they're not long-term studies. Well, I'm a researcher, and I was at the University of Maryland back in the early 90s, and I've got about 7 studies published in the literature. And I know how hard it is to even begin to do studies. So for those of you who are looking at a micronutrient supplement, in quotes, supplement, you've got lots of options. And I won't name the other options, but the single biggest thing that separates Juice Plus from the entire remaining field is the research. And the Juice Plus research focuses on 2 areas. Is it bioavailable and is it bioefficacious? Bioavailable means, does it get into your bloodstream? Yes, check that. And does it do anything for you? Does it do anything for you? Now, some would say, well, you know, we need a study that shows how broccoli helps reduce heart disease. Well, no one's going to do a broccoli study because you'd have to recruit thousands of men. You'd have to randomize them to broccoli, no broccoli, and follow them for 50 years. No one's going to do that. So those of you who are critical of Juice Plus and how it doesn't have these long-term studies, no one does. What do? We follow biomarkers. So let me remind you of something that Juice Plus did. They followed a biomarker called homocysteine. Prior to 1865, heart disease wasn't even known. In fact, the first heart attack was described in 1911, and then Sir William Osler, one of the 4 founders of Johns Hopkins University, reported the second case of a heart attack, and he was ridiculed by his colleagues for 10 years. It is now the #1 cause of death, and hypertension is a huge risk factor for it. Remember the study I just mentioned about nitric oxide and how it's a bronchodilator and a vasodilator? You need to get on Juice Plus because it will keep your arteries nice and pliable. So back to the bioefficacious study. So we follow biomarkers because that's what everybody does. Homocysteine is a marker of heart disease. And Juice Plus has a study showing how it lowers your homocysteine level. We're never going to have this 50-year study randomizing broccoli to a placebo group. No one's going to do that. We're going to have to follow biomarkers. Let me tell you about another biomarker. There was a study done in boys that were overweight, and on Juice Plus versus a control group, they lost weight, the ones on Juice Plus, but more importantly, it reversed their insulin resistance. Insulin resistance and excessive insulin is probably the biggest contributor to being obese and having metabolic syndrome, metabolic dysfunction. And for any women listening, PCOS, the #1 cause of infertility, is now also same thing, insulin resistance. So here's a Juice Plus study, followed a biomarker, hemoglobin A1C, which is a marker of insulin resistance. It's much lower on Juice Plus. So I hope you glean from this, and I hope you guys listening, heart disease, #1 cause of death, cancer, #2. Let me blend in the study I just finished about lowering your insulin level because insulin in excess is a growth hormone. What to grow. After that, when you're an adult, the only thing you need insulin for is to take glucose, to put it in the cell and make ATP. Anything extra, anything that doesn't get processed, where you have insulin resistance and you basically have too much insulin floating around, it acts as a growth hormone. And guess what it does? In your coronary arteries, the ones that Doug just described, the muscularis, the muscular layer in the arteries grows. And guess what happens? The lumen in the artery then shrinks. So insulin resistance, that's the mechanism of how it's linked to heart disease. So here comes the study from Juice Plus and a biomarker showing how in overweight boys, Juice Plus reduces insulin resistance. And when you talk about cancer and tumorigenesis, can you imagine what insulin resistance does in the setting of an early cancer? We know from an NIH study that we get hit 40,000 times a day with DNA mutations. Why don't we all get cancer? Because we have an immune system that functions correctly and it neutralizes these mutagenic cells. And now if you add to that a Juice Plus that then reverses insulin resistance, you can see the magic how it starts happening. These are all important things for you to know that will lower your risk of a heart attack, lower your risk of a stroke, which I call a heart attack of the brain, lower your risk of cancer, number one, and number two, cause of death in men. So I'll pass it back on to Karen or Doug.
Oh my gosh. Well, you're always amazing, Dr. Pohl. Thank you so much. I could not have done that slide justice like Dr. Pohl did. So I hope you guys understand that is the biggest difference between the Juice Plus being fruits and vegetables, not a multivitamin, NSF research, NSF certification, but the research. I know when I first learned about Juice Plus, I didn't really understand all the research, but my mom was a nurse. My dad, even though he had been in the Navy and he ended up being an optician, loved research just because he was a guy. And that was what sold them on Juice Plus 20 years ago. So I'm super excited. So Juice Plus is affordable. One of the biggest advantages to Juice Plus is the price, quite honestly. With everything going up nowadays, Juice Plus is not. Take a look at, fruits and vegetables in the grocery store. And I always challenge people. I'll say, take $2 and take $3.75, take $4, go to the grocery store. What are you able to buy with $4? I can buy one apple for $1. You know what I mean? Like you just can barely buy, you could get maybe one bunch of kale for $4. It's just ridiculous. And with Juice Plus, you can get nutrition from over 30 different fruits, vegetables, berries, and grains, and the omegas in there. So there's just nowhere that you can get the nutrition for any less money. You do not want to compare it. It's not apples to apples. We kind of already talked about that. To compare it to a multivitamin that's at the grocery store. You want to compare this to produce because that's what your body is getting, the nutrition from all those fruits and vegetables. And think about, I challenge you to think about some of the purchases that we're making. I make purchases all the time that I think, oh my gosh, did I really need to spend that? I mean, it's easily, because pricing has gone up, it's easy to go out to eat and at a fast food restaurant and you're spending $12 or $15 a day. And that's not feeding your health. You want to take money and you want to feed your health. You want to make good choices. So not that we can't have treats, but think about what you're spending money on that you could be investing in your health. And remember that with the Family Health Study, for every adult that goes on Juice Plus, you can sponsor a child between the ages of 4 through 26 years old. So then that's like buy one, get one free. And that's such an easy way to get your whole family healthy. So I am going to stop sharing because we have two more speakers. Paul, if you can unmute, I have two more speakers. They're going to share their stories. Paul, if you can unmute and share your story.
Okay. All right. Well, thank you to Karen and Doug and Sharon for inviting me to tell my story. And really, I mean, it all boils down to kind of what I've learned over the past 3 years or so. And, today I'm 59 years old. When we're men, when we're in our mid 50s, 55 or so, physicians tell us we have to start paying attention. And we pay attention from the bottom up, right? And that's, you start there. But I realized I'm not getting any younger. And I've sort of lived through, the adult life kind of being complacent in my food choices. And not to say that I was a horrible eater, but I was at my highest weight about 215 pounds. And I loved being active as a young man and staying healthy and fit. And the work I did actually kept me fit. But I've just learned that I have to be proactive in my health. And with my loving wife, she encouraged me. She was a high school friend of Karen, and they reconnected, and we learned about Juice Plus a few years ago. So around that same time, I had sort of a health scare, and I came on, had a little red spot come up on top of my head. I was losing a little bit of my hair so you could see it. So they asked me to do a biopsy, and, just safer than sorry. Found out through the blood work, actually, that it was cutaneous lupus. And they said that you needed, to begin to go to a rheumatologist and see about these things. And so it was an educational thing for me. And so it just manifested itself on my face. I had splotchy red dots around my eyes, around my chest. And not to mention, I've been on blood pressure medication for 20 years. So I had moderately high blood pressure. It was 140/90 and, occasionally higher. But, what I discovered through that process of, paying attention to my health and going to a specialist to see what was going on is they want to name your disease and they want to treat the symptoms with medicine. So one appointment after the next, the costs just started adding up. And I was like, I just want this to go away. So through the advice of my wife, I started taking Juice Plus. And the quad is what I still use today. And I believe that it has turned my health around. I can say, just taking the quad, my blood pressure is now probably averaging around 127/80, somewhere through there, 127/70. Really what changed other than that? That was just one small change that I made. And that's a phrase that you guys have coined, is the one small change. And it really is true. If you stop being complacent about your health, men, and do one thing, and then if you do one thing like the powerful product that is Juice Plus, you're going to see that it's going to change your chemistry, and you're going to see, like I've seen for my own self, I began to crave more fruits and vegetables, and I wanted to eat better. I knew that it was having an effect on me. So I've learned that what goes in my mouth had to change first. And when I began to eat better using a product, well, the Juice Plus is food, so I eat better. I don't take any supplements other than Juice Plus. And, what made it easy is just realizing that I could just start somewhere and begin to do better. 3 years later, I'm working out regularly. I was talking to one gentleman, Dr. Ray. As a young man in my 20s, I did martial arts, and I have the energy now to finish what I started 30 years ago. And, I'm going back to the same people I met back then. And, when you're 59 years old and you can get in there and have a blast doing something you love, it's great. So I can tell you just, from my own personal experience, it's the kind of thing that, if you're concerned about your health, do yourself a favor and use the quad. It's a great food that will help you change your diet. That's what I got.
That's that's enough. I mean, that's great to be able to reverse the autoimmune and lower your blood pressure is fantastic. And
Yeah,
it
my
goes,
blood, it's
right.
clear now, by the way. That's one thing I left out. I just had a physical last month and my blood work came back clear.
Yeah. And it's awesome because it is just part of what you did, you know, between the healthy eating. I see what Renee makes for you and you're so lucky. So I know I'm going to move up there and have her do Meals on Wheels for me.
40 pounds down, by the way.
Yep. Yeah. So it's not just the Juice Plus, guys. Juice Plus quite often is the catalyst. It's kind of what can get people started. And like Paul said, it can change the metabolic, the taste buds. And so you start to crave more. And when people see results, then you want to continue with the healthy eating because you're seeing the results. So I think that's important. Okay, so Ray, I am excited to have you as our final speaker. If you can unmute and share your story.
Great. You get me loud and clear now?
There we go.
Great. Okay. Well, I get to be a little loud. I get really excited. So no one's ever asked me to unmute before, Karen.
Right.
Okay. So first of all, I'd like to thank Karen, Doug, and Sharon for inviting me to the call. And for every man that's on this call, nothing against you ladies, I'd like to wish you a happy Father's Day, men. And I thank you for taking time out on this Tuesday evening to be able to have a conversation about your health, because your health is important to all those who depend upon you. As a father, I'm a single parent. I lost my wife to breast cancer. And it usually doesn't work out that way. Usually men, we go first. The ladies are here, but that is not the case in my family. So a little ounce of prevention, even being uncomfortable going to the doctor, as we all need to go to the doctor, man, can be helpful for you and your family. That's the legacy that you have. You've been blessed with. Make sure you're a good steward of that. So my name is Dr. Ray Perkins. Since there's a lot of people from Virginia on the call, the Commonwealth of Virginia. I'm from Richmond, Virginia. I'm matriculated at the University of Virginia. That's right. There's only one university in Virginia, and that's the University of Virginia. That's right. Any Virginia Tech Hokies, I'm sorry. But I matriculated at the University of Virginia. I played professional football. I played football for 18 years for the Dallas Cowboys, the Cleveland Browns, and the Cardinals. I currently live here in Phoenix. We'll be flying back to see my 92-year-old father for Father's Day back in Richmond, Virginia on Thursday. And so my story started this way. I started taking Juice Plus in 2010. I was introduced to my wife at that time. And my son always referred to me as Superman because I have a presence. I'm 6'6", 265 pounds. As I mentioned, I was a professional athlete, so my child used to always refer to me as Superman. Well, on October 23rd, 2013, they found that Superman had a chink in his armor that I could not overcome, kryptonite, if you will, that I was diagnosed with prostate cancer. I had cancer in 60% of my prostate, and I was stage 4. And so I had surgery December 10th, 2013. And I am 11 years of being a cancer survivor. What's unique about that story is typically if you're stricken with cancer, you have to do the regimen of chemo and radiation. My oncologist and urologist said to me that I was spared that because the prostate cancer did not spread. It was encapsulated, which is very, very, very rare. And he likened to what I do nutritionally, even though he doesn't sell the Juice Plus out of his office. He has me talk to any potential patient any person that has cancer that's going to have the surgery or going through treatment, have me share my story with them because he wants me to share why my results were so important or so drastic. Out of 10,000 patients that he has, I'm one of 3 patients, and he has international patients. His name is Dr. Kevin Bigelow. He's an Asian doctor. He's amazing. I'm one of 3 people out of his 10,000 clients that has his personal cell phone. He follows me. He said I have amazing anatomy, whatever that means, but he studies me. So I I used to take the trio, and at the point in time I was taking Juice Plus back then when I was diagnosed, the omega-3s had not yet come out on the market. But men, I will share with you, Vineyard, the purple pill, is your friend. Trust me. It helps reduce inflammation, but also it helps with circulation, along with the rest of the regular blend of fruits and vegetables. So that trio now, the quad, is very, very helpful for men. It's just a little ounce of prevention every single day that I take in order to ensure that I'm getting the 7 to 13 servings of fruits and vegetables, which is recommended. And as an athlete, if you work out, I work out every single day. I work out 7 days a week up at 4:30 a.m. Pacific Standard Time because I'm a high school vice principal now. And I can work 60 to 80 hours a week. And I have to have the stamina. I have to have the energy to be able to keep up. And I can keep up. And I'm 58, will be 59 years young. So that is kind of my Juice Plus story. I will never be without it just because I share you what my surgeon, what my doctor said to me. And I was blessed when I have to endure chemo radiation, and I'm 11 years cancer free. I know we're not making medical claims. I'm just sharing with you what my results have been. And so I would like to share and take the time to have us as men look at adding a little ounce prevention and prioritizing our health because our families, our legacy, they need us.
I love that. What a great way to end. I know I've been trying to follow the chat a little bit. Dr. Pohl, I don't know if you're available just for like another 2 minutes. I can answer it, but I'm sure you're going to do better at it by answering, is Juice Plus organic? And I would love for you to answer that if you can.
It's better than organic. I'm a hobby farmer, and I looked into getting an organic certification. I learned a lot about it, and it's just a paper certification. You have a government employee come to your farm, and for 3 years, they ask you, do you use anything that's not allowed on the list? And by the way, there are about 20 pesticides, herbicides that are on the organic list. So you can get certified organic and still use something that probably is a poison for you. So what's better than that? Well, here comes Juice Plus. We're better than organic because we have NSF certification. And those 20 pesticides and herbicides that are allowed and still be organic, we would fail the NSF certification if we followed organic standards. So the answer is we're better than organic because of the NSF certification. The organic certification is just a paper trail. It's an honor system. And whether you're looking at produce or you're looking at livestock, that certification is totally dependent on the honesty of the farmer. Now, there are lots of honest farmers out there. I don't want to take anything away from them, but one bad apple can spoil the bushel.
Oh my gosh, perfect answer. I absolutely love that. Okay, so we are going to end the recording. I want to thank everybody again for showing up tonight, my speakers for sharing tonight, because men's health, everybody's health is so important, but I think that, we don't focus enough on men's health specifically. So thank you everybody for your stories. Thank you everybody for taking time tonight to show up. And I really hope that you do make your health a priority. Have a great night. I'm going to stop sharing. Whoops, maybe. How come it's not giving me did it already stop recording? I hope not. It's not showing on. Oh, there we go.
I
Okay.
see it. I'm stopping it for you. We stopped on Facebook too.
Record